Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Sébastien Tremblay and I will be your moderator. Je m'appelle Sébastien Tremblay et je serai l'animateur de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we'll be hearing remarks from Councillor Keith Egli, Chair of the Ottawa Public Health Board, the Conseiller Keith Egli, Président du Conseil de santé d'Ottawa, followed by Anthony Demonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence, and la docteure Vera Etches, Chief Medical Officer of Health, Médecin-chef en santé publique. Unfortunately, le Maire Jim Watson is no longer able to join us today. After we hear from the panelists, we'll take questions from the media. We will now hear remarks by Councillor Keith Egli.
Thank you very much, Sebastian, and hello, everyone. Bonjour, Kwe. I'd like to thank everyone who's participating in today's media availability, either on the Zoom call or watching on YouTube. I'd like to begin by recognizing and acknowledging that there's been some frustration around the issue of booking second dose appointments for COVID-19 vaccines. I know my office has been getting calls and emails. My council colleagues have been getting calls and emails, as has Ottawa Public Health. Residents who booked their first appointment through Ottawa Public Health's booking phone line have not been given second dose appointments. And those who booked through the provincial booking system before the province adopted NACI's recommendation to change the second dose interval to 16 weeks have had their second dose appointments canceled. We recognize that these residents are anxious to know when and how they'll be able to book their second dose appointments. And many of them fear that they're falling through the cracks, particularly as more and more younger populations are now becoming eligible and are able to book their vaccination appointments. I want to reassure residents that second doses will not be missed, and details on how and when to book those second dose appointments will be communicated shortly. Ottawa Public Health and the City of Ottawa are committed to ensuring that all residents who received a first dose are able to access their second shot in a timely and efficient manner. At this time, the provincial booking system is not able to book individual appointments. A solution is in development to book single doses on their portal, which would allow residents to book their second dose within the recommended interval. Ottawa Public Health and the city's Emergency Operations Center are monitoring the situation closely and are in regular communications with the province. Should there be any unforeseen delays, our teams will explore and implement contingency plans. To those of you whose first dose was AstraZeneca, we recognize that you too are now anxiously awaiting news about your second dose. Please be assured that OPH and the City of Ottawa have been following up with the province, and we are awaiting further guidance from them. Like you, we hope that information will be provided soon. The Mayor and I, along with Mr. Demonte and Dr. Etches, met earlier today with Minister McLeod and raised all of these concerns. It was a positive meeting. We believe that we were heard and listened to, and we are told that the province will be making announcements around these various issues in coming days. We encourage all residents to sign up for the city's COVID-19 vaccine e-subscription so that they can receive these updates directly to their email. Many of you will have noticed that Ottawa COVID-19 rates have been slowly coming down over the past several weeks, as have the viral signal in our wastewater at the same time as our vaccine coverage is going up. We also recently reached a milestone in vaccine coverage among Ottawa residents, with over 50% of the eligible population having received at least one dose. All of this is great news, and it gives us hope for the not too distant future. I want to take this opportunity to thank Ottawa residents for their part in these successes. It's thanks to your continued adherence to public health measures that we've been able to bend the curve of COVID-19 in Ottawa, and thanks to your willingness and eagerness to vaccine the vaccine that we're growing our coverage rates daily. With the warm weather upon us and a long weekend ahead, I want to wish everyone a happy Victoria Day weekend. I hope everyone will get a chance to spend some time outdoors, get some fresh air, and safely enjoy the beauty of our city. I'll now turn the mic over to Mr. DeMonte.
Thank you, Chair. Good afternoon et bon après-midi. Yesterday, the province lowered the age limit so that all residents aged 18 and over are now eligible to schedule an appointment through the provincial booking system at one of the city's community clinics. It didn't take long for the city's remaining vaccine appointments for May and June to be snapped up. If we get additional vaccine, more appointments will be added to the system, and we'll let you know. I've said it before and I'll say it again today. Every Ottawa resident who wants the vaccine will get a vaccine. That goes for second doses as well as first doses. Je l'ai déjà dit et je le répète maintenant. Toute la population d'Ottawa qui souhaite se faire vacciner le pourra pour la première comme la deuxième dose. More than 50% of eligible Ottawa residents have received at least one dose of COVID-19 vaccine. To date, more than 496,000 doses have been administered in Ottawa. We expect to administer more than 500,000 doses. Currently, we have more than 172,000 appointments booked at our community clinics between now and the end of June. As our team has proven over and over again, once more vaccines become available, we are ready to ramp up quickly and adapt based on vaccine supply and the demand for appointments. Notre équipe a démontré à maintes reprises qu'elle est capable d'accélérer les activités rapidement et s'adapter en fonction des stocks de vaccins et la demande de rendez-vous. As required, we have the ability to enhance capacity at established clinics such as the Saint Laurent Complex and the Horticultural Building at Lansdowne Park. And we continue to explore the feasibility of opening additional clinics and establishing drive-through locations should supply exceed our capacity to administer vaccines through our current established tactics. Youth between 12 and 17 years of age will be eligible to book a vaccine beginning the week of May 31st. Our team is planning to operate dedicated clinics for youth and their family members during the weeks of June 14th and 21st. The province has also announced that high-risk healthcare workers, First Nations, Inuit, and Métis community members, and individuals with certain health conditions are eligible to receive their second dose of COVID-19 vaccine earlier than the 4-month interval. We also are aware that there is a segment of our 80-plus population that received their first doses back in March and are eagerly awaiting information on when and where they can receive their second dose. More details about the dates, locations, and how to book for all these groups will be broadly communicated as soon as available and feasible. Plus de détails pour les groupes seront communiqués dès que possible. The province has advised that they are modifying their online booking system so that single appointments for second dose may be booked by the public. As soon as this functionality is added to the system, the city will undertake a public communications campaign. Our team is working to ensure that everyone eligible for a second dose will receive one within the specified time frame. Notre équipe travaille pour s'assurer que chaque personne admissible à une deuxième dose la reçoit dans les délais prévus. Finally, I want to acknowledge the ongoing contribution of our primary care providers to Ottawa's vaccine rollout. We have had nearly 100 family physicians support our community clinic operations, and countless others have administered doses through their offices and participated in our mobile vaccination teams. As we all know, the administration of AstraZeneca has been put on pause. However, we expect the province to begin allocating doses of Moderna to primary care providers in Ottawa starting the week of March 24th. And this is great news. It will help to ensure that we can get even more vaccines into arms throughout the month of June. The best way to get more accurate information and up-to-date information about the vaccine rollout in Ottawa is through the City of Ottawa and Ottawa Public Health. You can find that information on ottawa.ca and ottawapublichealth.ca or follow us on our social media channels. I also encourage everyone to subscribe to COVID-19 vaccination update newsletter available through ottawa.ca. Again, we want to ensure you that everyone who wants a vaccine will be provided the opportunity to get one. Une fois de plus, nous voulons vous rassurer que chaque personne qui veut se faire vacciner aura la possibilité. We understand that this can be frustrating and that many residents want this vaccine as soon as possible, but there is light at the end of the tunnel. We will get through this summer and we'll get it done. Nous y arriverons cet été et ce ensemble. Thank you very much. Merci beaucoup.
Thank you, Mr. Demonte. We will now hear from Dr. Vera Etches.
So hello from me, bonjour, Quay. We are getting there, Ottawa. Our COVID-19 monitoring indicators are showing positive signs. We're seeing fewer people test positive. That percent of people that go for a test that comes back positive is dropping, though it's not yet low. Our wastewater levels continue to trend downward, and we are seeing fewer outbreaks and fewer hospitalizations. This is a direct effect. It's related to your efforts, and it's evidence that the public health measures in place are working. So we can see that when we all work together, we have this goal, it's having a significant impact on the community. L'union fait la force. Lorsque nous travaillons tous ensemble, cela a un impact important sur notre communauté. And while this is encouraging, we are not yet in a position where we can begin to lift the public health measures currently in place. Soon, but not yet. We have learned from past resurgences here and in other countries around the world what can happen when restrictions are lifted too soon. We will need to ease slowly into activities as vaccination coverage grows. And looking to the months ahead, I can tell you, well, it won't be a normal summer. We will likely see less restrictions, more restrictions lifted as these trends continue. It could be a summer like last year where small outdoor gatherings are permitted. We can see the resumption of outdoor recreational activities. And we can have greater confidence about growing the size of gatherings as vaccination coverage increases and COVID-19 remains under control. So we're waiting for information from the province on the specifics, but I do want to make this very clear. Public health measures like masking, maintaining physical distancing, getting tested when you have symptoms that could be COVID, and hand washing will remain in place. Nous avons une réouverture progressive des activités en fonction de la couverture vaccinale. Bien que nous attendons plus de détails du gouvernement provincial, je tiens à le préciser très clairement. Les mesures de santé publique comme le port du masque, la distanciation physique, le dépistage lorsque vous avez un symptôme de la COVID-19 et le lavage des mains resteront en place pour encore des mois à venir. And so as Chair Eglai and Mr. Demonte have said, I do thank you for your patience. This is a vaccine rollout that is going as quickly as the vaccine comes. And it's good news that all adults 18 and older are now eligible, but we don't yet have the supply to ensure everyone is accommodated immediately. So I want to reassure everyone again, like others have said, we will eventually have enough vaccine for everyone who wants it. It's going to take a little bit of time, but you won't be forgotten. When people due for a second dose won't be forgotten. The province is participating and anticipating and providing a solution for booking second doses very soon. Je tiens à vous rassurer que nous aurons à terme assez de vaccins pour toute personne qui le souhaite. Vous ne serez pas oubliés. Les personnes qui doivent recevoir une deuxième dose ne sont pas oubliées. And I know that asking for patience is hard, especially when you're seeing other people around you being vaccinated. I love seeing those selfies about people getting their vaccine, but I know it can cause anxiety to people who haven't received theirs yet. So if you haven't yet received a vaccine or booked your appointment, I want to remind you that the vaccination for each person gets us closer to community immunity. So every person who's getting vaccinated helps protect not only themselves, but others around them. And when the vaccination rates rise in populations at higher risk for COVID-19, it helps protect the whole community. We'll continue to work to ensure that everyone who wants a vaccine can get one. And chaque personne qui se fait vacciner aide à se protéger non seulement elle-même, mais aussi les gens de son entourage. Lorsque le taux de vaccination augmente dans les populations plus à risque de la COVID-19, cela aide à protéger l'ensemble de la communauté. One last thing I would like to address is an emerging trend we're seeing regarding vaccine preference, particularly when it comes to Pfizer and Moderna. I want to remind everyone that both vaccines have been approved by Health Canada and they're safe and effective. According to Health Canada, Pfizer is expected to be 95% effective against COVID after 2 doses, and Moderna is expected to have 94% effectiveness. But both rely on the same scientific approach to protect against COVID-19 infection. They're both are mRNA vaccines. So I continue to urge people to accept the first vaccine that's offered to them. Les vaccins Pfizer et Moderna ont tous deux été approuvés par Santé Canada, sont sûrs et efficaces. Les deux s'appuient sur la même approche scientifique pour se protéger contre l'infection COVID-19, car ils sont tous deux des vaccins ARNM. No matter what, we do have the power to help reduce transmission of COVID-19. It's important that each of us continue to practice the public health measures for now. This is my advice for people who've been vaccinated and those who have not. Regardless of our vaccine status, daily screening for symptoms of COVID-19, physical distancing, and wearing masks indoors and when in close contact with others, good hand hygiene. These are the keys to limiting COVID-19 transmission. So thank you, merci, miigwech.
Thank you, Dr. Etches. I want to let everyone know that we also have available for questions from the media following the statements. Disponible pour répondre aux questions des médias, nous accueillons aussi Dr. Trevor Arneson, Associate Medical Officer of Health, Ottawa Public Health, médecin adjoint en santé publique Ottawa. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We'll now start with Matthew Cooper at CBC Ottawa.
Hello, everyone. I hope you can hear me.
We sure can.
Excellent. Okay. First, I was hoping to ask about just the Quebec reopening plan was released with quite a bit of detail. That means that across the river, things are going to be changing as soon as I believe we're looking at just a little bit more than, well, next week. I guess with the plan that you've seen from the Quebec side, what would your message to Ottawa residents be, and what are you hoping to see from the Ontario government when it comes to a reopening plan?
It is encouraging to see progress in the control of COVID-19 so that we can get back to more activities. We're seeing this on the other side of the river, and we're seeing progress here too. In Ontario, we are still under a stay-at-home order. And so, the implication is that we should still be avoiding non-essential interprovincial travel. I think what we're looking for from the provincial government is the same kind of ability to look ahead and anticipate what's coming based on different measures like the immunization rates, the control of COVID-19. What can we expect? And so, because both provinces are considering how COVID is transmitted and trying to keep transmission down by avoiding high-risk situations, I would expect there would be some similarity in the type of activities that are first permitted again in terms of outdoor activities, emphasis on smaller group activities. And I do expect that we'll have that detail from the province soon.
On the vaccine rollout, it seems pretty clear that well, the rationale for opening it up to the larger age cohort for covering from 18 up, kind of all at once, covering almost 2 decades in one fell swoop was supposed to be, I suppose, the consistency of shipments of vaccine. But it looks like we're seeing from the experience of people in the Ottawa area that those doses weren't there for people to even sign up for vaccine yet. Did the province go a little bit too fast there? Well, I guess what is your sense of how this may be affecting people actually signing up, following through, and getting the shot in their arms?
Well, I think if I can just start, Tony, and you can jump in. We did anticipate that it would be 30 and above this week, and then found out that it would be 18 and above. That did create a challenge for sure. However, on the plus side, we got over 40,000 people registered in 2.5 hours to get vaccinated. And we have had discussions, and Tony and Vera continue to have discussions with the province. As we've indicated, there will be vaccine for everyone. And as that vaccine becomes available, we will open up more windows of opportunity. As Mr. DeMonte, and perhaps you can elaborate, indicated earlier, we also will be, as the vaccines become available and the windows of availability become available, looking at opening more sites to service more residents of Ottawa. So I'll turn it over to Tony now.
Thank you, Chair. So Matthew, I think your question's apropos. I think what we saw is, and this is difficult part of the process. I think the Chair mentioned it. What's clear in Ottawa is when we have vaccine availability, people are booking and moving forward in that. I think we're seeing regional differences. So yes, dropping to 18 in Ottawa without significant additional vaccine does create a bit of a bottleneck. But I want to remind you, just some of the data that I mentioned. By end of day today, we'll have vaccinated, administered more than 500,000 doses. And currently, from now for now to the end of June, we have 172,000 booked. Always said, if you've got a booked appointment, there's a vaccine for you. Good news. I think you're going to see some regional differences. We're in Ottawa, and our job here is to make sure that we move our progress here as quickly as possible. So yeah, I would appreciate having more vaccine, and that will come. So the download this week was perhaps a little quick for us regionally, but elsewhere in the province, maybe it wasn't. So I think we have to look at that. The decisions are being made provincially, and for the benefit of the entire population of Ontario. For Ottawa, it did give us a bit of a challenge, but I think that'll be picked up. And as soon as we get more vaccine, we'll make it available. And I know that, as we saw again yesterday, when we put vaccine appointments in the system, they're used up right away.
Thank you. We will now move on to Eric O'Brien at City News Ottawa.
Hi, everyone. Dr. Etches, I'll start. My question's for you. You mentioned that all the indicators in the city are on the right track, right? They're getting more and more positive. I'm wondering, we've seen a slight jump in the hospitalizations over the last couple of days. Is that in regards to Mother's Day, the effects of Mother's Day? Could we see more of these effects in the coming days? And we have to mention this weekend as well.
Yes, I appreciate the sensitivity to any suggestion that COVID might be rising again. And it's a real risk. The risk of resurgence remains until we do have significantly more immunity in our community. The increase in hospitalizations isn't linked back. We can't say that it's due to say social gatherings at Mother's Day. We haven't seen that pattern. Some are related to hospital-based outbreaks or other outbreaks. So we'll keep an eye on that, and I do think it is worth everyone keeping in mind this ongoing state that we're in, where COVID levels are still at the place where they could resurge. And so for this coming weekend, to limit our close contacts, certainly We know it's going to be beautiful to be outside and to encourage those kinds of activities that are lower risk. Again, we aren't yet out of the stay-at-home order, and we're not still at those higher levels of vaccination that will provide as much protection as we need. So a little bit longer, ask people to limit those close contacts.
Thank you. And I have a question from one of my colleagues who wants to know a little bit more about directions from the province with regards to vaccine allocations. What are the directions that you're getting from the province on that?
Can you give me a bit more detail when you mean vaccine allocations, like what?
Like inside of the city, like are there more vaccines going to certain communities to be able to get the vaccines out quicker? Or is it just generally we have the same amount going across the city?
So I'm having perhaps a little bit of challenge here this afternoon, and maybe me and your question may be clear. So first, we have multiple streams to vaccinate. So we have our mass vaccination clinics, which are open to everyone, but we also have targeted vaccination streams for different groups. For instance, high-risk healthcare workers, we have a stream for them. Our high-risk neighborhoods, we've been focusing on that with multiple strategies, and that's been very successful for us. So I'm not sure I'm answering your question, but the vaccine that we get here in Ottawa is available for the entire population. So am I getting to the question that you wanted?
I think I can add as well, Mr. DeMonte, if you like. So the province is the body that allocates vaccine across their different channels. So the province decides how much vaccine will go to pharmacies, for example. The province has made dedicated allocations to primary care channels, dedicated allocations for First Nations and urban Indigenous populations, and then what comes to local public health units. And that's where Mr. DeMonte was describing within local public health units, we decide the best ways to reach the population through the public health operations. And they're very different and diverse. We have where we're working alongside primary care providers as immunizers, and we have mobile services where paramedics are playing a role, and primary care providers are also supporting a lot of the mobile work. We have other kind of walk-in, pop-up approaches in neighborhoods. And so that allocation is part of what's assessed as the provincial supply is confirmed. We do not put up appointments or make until the allocations from the province are confirmed, so that we don't have a situation where we're having to cancel appointments.
Thank you. We will now go to Josh Pringle at CTV Ottawa.
Thank you very much. My first question is for Dr. Etches. Have you had any discussions with the Ontario government about what a reopening could look like once the stay-at-home order ends in 2 weeks? And would you support a regional reopening, or do you think Ontario should open up across the entire province where all rules are the same?
I haven't been involved in any detailed conversations about what the framework is or what the measures will be. The province has a public health measures table that's providing that input. We have had conversations with the province previously about school reopening, just that one aspect where there was expressed interest in a regional approach for the schools, because we would like to see students be able to benefit from schools reopening.
Josh, your second question?
Sorry, wrong button. Any idea what you would like Dr. Etches moving forward to June 2nd? Do you have an idea of what you would like to see start to reopen in June 2nd as we head into the summer, as COVID cases come down and vaccination rates continue to go up?
I think the emphasis to begin with would ideally be on outdoor activities. So really enabling people to start to connect outdoors where the risk of COVID transmission is greatly reduced. So that may be getting back to some of the recreational activities outdoors. You could see moving on to patios, outdoors, always needing to pay attention to where there's a risk created of going indoors or coming into close contact with people outside of our households. I think that, and then monitor and see, we're tolerating this. Usually it takes a couple of weeks to see if there's any upward pressure on COVID transmission. So proceeding slowly, step by step.
Thank you.
Thank you. We will now go to John Willing at the Ottawa Citizen.
Thank you very much. Dr. Etches, the mandatory masking order at playgrounds and around playgrounds, what do you see as a trajectory on that order? Can you predict when that might end based, I guess, maybe on case counts, or what's your thinking on that?
The order requires masks to be worn on playgrounds. It was created to address the challenge we were seeing with crowding on playgrounds when the rate of COVID was skyrocketing, rising very quickly, and where people were coming into close contact with each other. So that was for a defined period of time. It does indicate that it's in place until, I believe, May 24th or 25th. And that is not likely to be renewed. But the recommendation to continue to wear masks when you are at risk of coming into close contact with someone will remain. That is something the science table has also upheld, that even outdoors you can have that risk of transmission. And so to continue to keep that in mind.
Thanks, Doctor. And you mentioned in your opening remarks, there's been some vaccine preference shown between Pfizer and Moderna by people looking for vaccines. Can you explain a little bit more? Are people which are people preferring out of those two right now, and why are you perceiving this?
These are reports from the team, so I may ask Dr. Trevor Arneson to comment further on this.
Sure. Yeah. So it's a good question because I think it surprised many of us, but there seems to be recognition of Pfizer out there, and maybe that's because of more news about Pfizer or talk about Pfizer. But it seems to be a brand recognition thing that is happening, where people are hearing about Pfizer as being the vaccine that they should be looking for. I think that's a bit unfortunate because the Moderna vaccine is very similar to the Pfizer vaccine, not only in its effectiveness as a vaccine, but in its chemical makeup and its structure is almost identical. So I think it's the message needs to get around that these vaccines are all effective and a really important part of the campaign. And it may seem harmless to refuse a vaccine at a particular time, or try to choose a vaccine, or try to locate where the clinic is that has the vaccine that you think you should be looking for. But it does create a lot of operational and logistic challenges that could slow down the response. So certainly these vaccines, they're equivalent, but for whatever reason, people seem to be preferring one over the other.
Thanks, Doctor.
Thank you, John. On va maintenant à Julien Paquette avec le droit.
Bonjour, je crois que la première question, ce serait pour M. Dimonté. Je voulais savoir, on a évidemment pas assez de doses présentement pour la demande en fonction des groupes d'âge qui sont admissibles pour la vaccination. Quelles sont les dernières nouvelles que vous avez reçues au niveau justement de cet approvisionnement-là? Est-ce qu'on s'attend à recevoir plus de doses bientôt, ou à quel moment on prévoit être en mesure d'ajouter des plages horaires?
Oui, merci Julien. Ce qu'on nous dit, c'est que vers la fin mai, le 31 mai, on devra avoir des vaccins supplémentaires qui arrivent. C'est à ce moment-là qu'on entend parler que probablement on va ouvrir la vaccination pour les gens âgés de 12 à 17 ans, dont les enfants d'école. C'est vraiment à ce moment-là qu'on devrait voir si on va recevoir des vaccins supplémentaires. Ça n'a pas été encore confirmé, et comme Dr. Ametchis l'a mentionné, et moi je l'ai mentionné à plusieurs reprises, on ne met pas des rendez-vous dans le système si on n'a pas la confirmation de vaccination. On commence à voir que oui, il y a des vaccins qui s'en viennent, mais jusqu'à ce que ça soit confirmé par la province, on ne rajoute pas des rendez-vous dans le système parce qu'on ne veut pas se retrouver avec des rendez-vous prévus et pas de vaccin. À ce moment-là, on doit canceller, comme on a vu ailleurs. Ça n'a pas été le modèle qu'on utilisait à Ottawa depuis le début. Donc, je prévois d'ici la fin mai, on devrait avoir des nouvelles supplémentaires.
Parfait. Pour ma deuxième ma question suivie, I'll ask my follow-up in English in case Councillor Eli wants to chime in with from the political side of it. But would you have wished that the province had consulted you before going to 18 plus this week, so you would have been more ready and able to respond to this high number of demand for vaccine appointments?
Chair, I believe that was for you.
Yeah, no, I guess what I would say to that, everybody has a lot of balls in the air. Everybody's juggling a lot of priorities. As Mr. DeMonte indicated, some of the decisions the province is making, they're making on a provincial basis in terms of what they see as the biggest health benefit for the total population, and that creates issues at regional or local levels in terms of what our priorities might be or what our challenges might be. I think it's safe to say that more communication at all times with all issues is beneficial. But I just want to reinforce we had a very positive meeting this morning with Minister McLeod and with some representatives from the health ministry as well. Mr. Monte was there, as well as Dr. Etches and the mayor and I. We had a good discussion. I believe we were heard on all the issues that we put on the table, and one of those issues included vaccine supply. And the indications we were given is that we would be hearing from the province with announcements in coming days. So that working relationship is still there. Like everything, there are bumps in the road all the time. We've said that from the beginning. This is a huge rollout. But as I say, good positive meeting this morning, good dialogue, and I believe that we were listened to.
Thank you very much.
Merci. We will now go to Bruce Deachman at the Ottawa Sun.
Hello there. Can you hear me?
We sure can. Go ahead.
Thanks. My first question is for Dr. Etches, and I know you've somewhat addressed this coming weekend, urging people to limit close contact and stick to outdoors. But I'm wondering if you can describe your level of concern over the long weekend, given that the past 3 waves, the spikes, have all occurred just after long weekends, 2 Easters and a Christmas New Year. And you could argue, I think, that Labor Day and Thanksgiving last year was part of a 6-week plateau that included 0 to 19-year-olds getting infected in higher numbers than previously.
Well, I give a lot of credit to people of Ottawa who are continuing with the stay-at-home measures sufficiently to be able to bring the rates down. We weren't under a stay-at-home order in those previous holidays, and we have also seen what happens when we do relax too quickly. So we've learned from that about that risk of resurgence. So just wanted to clarify for people who may still be wondering or thinking about what difference does the vaccination make. The vaccination program to date has made a difference. It has protected older adults in our community. We are seeing less hospitalization, less death in older adults, and we're very thankful for this. It's just that we continue to see the risk of COVID rising and spreading and reaching people who may still be older and vulnerable. Not everyone is immunized, and younger age groups as well can have serious illness. So unfortunately, we have seen another death of someone in their 50s this week. So we need to continue to prevent all the cases that we can. as that level of protection from the vaccine comes down to the lower age groups. So not there yet. It's coming though. We can see the difference this will make. And I think, I really appreciate that people in Ottawa are hanging on and that we can make it through this holiday.
Okay, thank you. And my follow-up, I don't know whether it's for Dr. Etches or Mr. DeMonte. You mentioned that the city is now 50% vaccinated, at least of eligible people. And I'm wondering what that number is. After that first wave of getting people in long-term care and retirement homes vaccinated, I assume they're part of the 50%. But those actual numbers I don't see on the dashboard except as a percentage of long-term care. So I'm wondering what percentage of the city, apart from long-term care and retirement homes, is vaccinated.
Mr. DeMonte, I do have some numbers here, if that's helpful. I could explain that when you're talking about residents of long-term care homes, that's about 3,800 people. And residents of retirement homes, it's about 7,700 people. So it's altogether a small proportion of the 500,000 that have had at least one dose, and those populations actually also have had 2 doses. So the vaccine that's been allocated to that population, you can almost double that, where the 2-dose coverage in long-term care homes is 98%, and the 2-dose coverage in retirement homes is 89%. So you can see it's an important part of the population to have protected first, but it's of the overall populations immunized so far.
Thank you so much.
Okay.
Thank you. On va maintenant à Nafi Alibert avec Radio-Canada.
Oui, bonjour. Je voulais savoir, avec la pénurie actuelle, est-ce que ça vous semble réaliste l'objectif provincial que tous les Ontariens qui veulent se faire vacciner puissent le faire à compter de juillet, voire même celui du gouvernement fédéral qui parlait plus de septembre?
Je peux peut-être commencer. Oui, je crois que ça continue d'être réaliste. Oui, cette semaine, ce qui est arrivé, et on n'avait pas prévu de diminuer l'approche pour les 18 ans et plus. On pensait que c'était pour les 30 ans et plus. Donc, le vaccin qu'on avait en stock ne pouvait pas répondre à cette demande-là si grande. Par contre, avec ce qui est prévu à arriver bientôt, on croit qu'on va être en mesure de vacciner d'ici la fin de juin l'ensemble des gens au moins une dose. Et on a déjà en même temps commencé des 2e doses dans certaines catégories par priorité qui ont été identifiées par la table scientifique, dont les travailleurs de la santé, les gens avec des problèmes de santé graves, etc. Donc, ces groupes-là ont déjà commencé leur 2e dose.
Parfait, merci. Je voulais aussi voir, Dr. Etches l'a rappelé, là, le déconfinement dépend de la couverture vaccinale. Là, on est en train de voir le Québec voisin qui s'apprête à réouvrir. Est-ce que vous anticipez qu'il y aura un grand décalage entre la réouverture d'Ottawa et l'Outaouais? Et quel impact psychologique tout ça, là, ça pourrait avoir sur les gens d'Ottawa, selon vous?
Je suis heureuse pour la population à Outaouais qui a succès avec la diminution dans la COVID-19 dans leur communauté. Et c'est bon de voir. Et on a le travail à cet côté aussi de continuer avec la diminution dans le niveau de COVID dans notre communauté. Pour nous, à Ottawa, nous sommes dans environnement avec un règlement où il faut rester à la maison et ça continue. Alors, je voudrais voir la situation où le voyage entre les 2 provinces reste pour les raisons essentielles. Et le jour pour nous va arriver bientôt. C'est important de continuer avec les mesures maintenant, parce que le niveau de protection avec le vaccin n'est pas assez pour éviter une augmentation dans la COVID-19 encore. Il faut continuer avec les mesures à ce moment.
Parfait.
Merci beaucoup. On va maintenant à Louis-Charles Poulain avec TVA Ottawa-Gatineau.
Est-ce que vous m'entendez?
Oui, on t'entend.
Oui, en fait, la question a été posée au départ en anglais, mais si c'est possible de répéter en français. Comme l'Outaouais, là, on voit qu'il y a des mesures de déconfinement. Est-ce qu'on s'attend qu'Ottawa il va avoir un plan semblable qui pourrait être annoncé là, prochainement avec des différentes étapes pour un déconfinement cet été?
Je pense que la question c'est concernant le plan à Québec et qu'est-ce qu'on veut ici pour le déconfinement. Non?
Oui, on s'attend à voir un plan comme ça du côté d'Ottawa là, pour l'été.
Oui. Pour moi, je reconnais que c'est le domaine de la province de déterminer le plan pour la réouverture des activités et lieux. Et je que le plan va être annoncé bientôt. Mais concernant le principe, c'est important d'aller lentement et d'utiliser la connaissance de les environnements qui donnent plus de risques et choisir les opportunités qui donnent moins de risques. Alors, c'est important de concentrer, par exemple, au début sur les activités dehors et aussi avec les contacts, les groupes petits et avec plus d'expérience. Quand on change quelque chose, on a une période de temps pour évaluer les mesures. Et si le niveau de COVID-19 continue d'être quelque chose qu'on peut gérer, on peut continuer avec une autre mesure, peut-être un plus grand groupe, par exemple, et éventuellement les rendez-vous à l'intérieur. Mais on verra. J'imagine la province va faire un plan qui considère les risques.
Puis, comme question de suivi, le ministre responsable de l'Outaouais a dit « On aime bien les Ottaviens, mais restez chez vous, là, au sens où, comme on déconfine de l'autre côté de la rivière, peut-être que les gens vont avoir tendance à se promener. » Comment on réagit là, à ces propos-là?
Je m'excuse encore, peut-être je n'ai pas compris tout, mais à leur côté, ils veulent que les Ottaviens restent chez nous. Oui. Et à cet côté, c'est le règlement, c'est de rester chez nous. Alors, c'est similaire.
Parfait, merci.
Merci beaucoup. And we will now go to Patrick Uguccioni with Your Community Voice.
Good afternoon. My first question was for Mr. DeMonte. And my questions are about the 12 to 17 age group. You had a few dates there. So am I correct? You said May 31st that people will be able to start registering?
That's correct. The province has announced that that's the date that they're targeting to be able to allow the 12 to 17-year-olds to register for a vaccine.
And you mentioned June 14th and 21st. What was?
So we're planning in those 2 weeks, and that's a target weeks where so they can begin registering May 31st. But those are the 2 weeks where we're going to try to do a blitz across the province to get those children vaccinated and their families. And what we're going to do in Ottawa is we're going to set up 2 specific clinics to be able to receive those. They can go to any clinic, but over and above, we'll also set up those clinics as well too to receive those 12 to 17-year-olds and their families. So very much a focused approach to try to get those school-age children done, and that's the approach across the province.
And you mentioned, if I'm correct, May 24th that Moderna will be made available in primary caregivers. Did I get that right?
I'm sorry, I'm having trouble hearing you, and I know I'm having some challenges here.
You mentioned the date May 24th for Moderna at primary caregivers. Did I get that right?
So yeah, we're expecting another shipment of Moderna to arrive, and I think Dr. Etches were referring to some of the primary care givers and physicians were using AstraZeneca, and with the pause, there's a bit of a delay. So we're expecting to get Moderna in, and we'll be able to start transferring to Moderna. So that'll be made available to them as well too.
And sorry, if I could ask one more question, and it'd be for Dr. Etches or Dr. Arneson, around 12-year-olds. In the other age groups, it was if you turned that age in this calendar year. So is that the same for the 12-year-olds? Like if I'm 11 years old on May 31st, but my birthday's in December 1st, can they register then or?
Yeah, so it's in the product monograph, they have to be 12 years and older. So that's what's been studied. So it's not a policy position, as it's actually who can receive it based on the studies and on the Health Canada approval. So it has to be 12 years old when you get the vaccine. And then just in reference to the other one, the May 24th is the provinces told us the week of May 24th is when we expect the first shipment of Moderna for primary care offices in Ottawa.
Thank you. Thank you very much.
Thank you. And that concludes today's media availability.
Got skipped over here.
Oh, Craig, sorry. Craig, go ahead. Craig Lord at Global Ottawa. Sorry, sir.
No worries. Seeing online, Councillor Glenn Gower was tweeting that splash pads are supposed to open in his ward this weekend. So just wondering, maybe Anthony DeMonte, how is that working with the stay home order, the mask mandate? What will that look like this weekend?
Greg, you're catching me off guard. That's the first I hear about it. I'll have to check with my colleagues. I can certainly follow up unless Vera has more information. She took her microphone off.
I do know that our teams have been talking, and I think the assessment is that a splash pad is very similar to a playground in terms of its exemption to be open under the provincial stay-at-home order. And when it comes to wearing masks, we certainly understand that a mask is no use if it is wet. And so that, we have to take a practical approach there that, we don't expect children to wear masks at splash pads, but we do underline and recommend highly that children try to distance some other households when they're using splash pads. This was something we went through last summer, and people were able to find a way to enjoy the outdoors. We know splash pads are an important support for families when it gets hot, and so I'm happy to see them open.
Thanks, and sorry for catching everyone off guard there, but I think my follow-up would also be for Anthony DeMonte. And in terms of when we're adding appointments to the provincial system, when we get that supply confirmed, is that something that will always be announced in advance, or is there any productivity in people, consistently refreshing that site regularly to see if there are just a couple extra slots opening up?
Yeah, no, just for the purposes of everybody's sanity, I know we'll advise. So instead of having to go every hour and looking on the website, we'll clearly advise people when we're adding extra appointments to the system. So right now, our 172,000 appointments that we have available are fully booked up till June. So if we get more, we'll let people know and we'll tell them when we'll be added to the system. So I would encourage that, and no problem for catching me off guard. That's okay. It's I'm not always up to speed on everything at the last moment, so all good.
Thank you.
All right, thank you so much for that. And sorry again, Craig. That will wrap up today's media availability. Thank you everyone for your time today. Merci à tous pour votre temps aujourd'hui. Have a nice Wednesday.